Well, good morning, everybody. Thank you for joining us on our press briefing with regard to the state's response to the pandemic. We appreciate you joining us. We're going to have a guest here in a moment, Mel McNay, who is the CEO of Great Plains Health in North Platte. But before that, I just want to remind people that, again, with the pandemic, we need people to continue to practice all of the good tools that we've given you with regard to keeping that 6 foot of distance between you and other people, washing your hands often, 20 seconds at a time. That actually kills the virus. Wear a mask when you go to the store. Make sure that you're working from home if you can. Certainly stay home if you're sick, and everybody in your household needs to stay home as well. Make sure you're not spreading the virus. You can go get tested and confirm you don't have coronavirus, but if you're sick, please stay home. That's going to be important. Obviously, with the holiday season, a lot of people are going to be shopping. Please go shopping by yourself. Don't take the whole family with you. If you're going grocery shopping, just go once a week, and again, leave the kids at home. Go by yourself. So these are all things that we can do to help slow down the spread of the virus. And of course, also avoid the 3 C's, those confined spaces, crowded places, close contact. It's a virus that spreads from one person to another, so if you can avoid those, you'll slow down the spread of the virus as well. That's particularly important as we think about the holiday season, and traditionally we have holiday parties. Good idea to maybe postpone those till sometimes later next year, or if you're going to have them smaller groups of people. And again, if you're going to have people together, wearing masks is always going to be helpful to slowing the spread of the virus. So please remember those things. Look, folks, nobody wants to be sick over the holidays when you may be spending time with your families. Nobody certainly wants to be in the hospital. You don't even want to be quarantined. So slow down right now is going to be the best thing to do to be able to avoid being in quarantine or being sick over the holidays. So please remember that. Also, all of this, what we're doing is to make sure we preserve our hospital capacity. We've got 28% of our hospital beds are available today, 26% of our ICU beds, and 70% of our ventilators. We are also sitting at 779 hospitalizations right now. We got them right up here on the board. And that's been pretty stable for the last week. And that's been stable below our level of 20%. So if we have one more day today of being at that level below 20%, our 7-day rolling average will have been below 20%, and that means we will move from our orange phase to our yellow phase. So you may recall about a month ago, November 13th, we published our chart, and you can actually see the lines on the chart here, right? You can see red, orange, yellow, dropping down to blue, and then green at the bottom. Those represent different increments. So 25% above is red, 20 to 25% is the orange, 15 to 20%, and we're in that category right now and have been for almost a week, is the yellow. And if we continue to stay there, then we will be going into that yellow phase to relax some of those restrictions. So that's potential that could be as early as 12:01 a.m. tomorrow morning. If we see a day, now if it jumps up a bunch, that could change that. But if we stay stable at 12:01 tomorrow morning, we'll be going to yellow. And so even though we're going into yellow, we remind people that we still have the virus in the community. You still need to continue to practice all the rules that we've been talking about with regard to the pandemic and slowing things down. But if we go into yellow, that will, for example, allow for elective surgeries if a hospital can maintain 10% of capacity. I know that's an important point right now as people have deductibles and are trying to get those end-of-the-year surgeries in. All right, so another way that we can help slow the spread of the virus is take advantage of testnebraska.com. We have had over 576,000 Nebraskans sign up for testnebraska.com. We have delivered over 513,000 tests through testnebraska.com. Our turnaround time for the last 7 days has been about 30 hours. So we're getting those tests turned around quickly. A friend of mine told me he got tested and they turned his test around in 18 hours. So we're really turning that around very quickly. So Test Nebraska is a great way, especially if you're going to go see friends or family. Great opportunity. Get tested. Make sure that you don't have it. That's a great way to be able to help slow down the spread of the virus. So testnebraska.com is a great. Please sign up and get tested. And we've announced this week we're expanding test slots here in Lincoln, for example. So we've got lots of capacity. So please look for that. All right. So as we've talked about, all the precautions we've taken, have been to slow down the spread of the virus and preserve our hospital capacity, to make sure we can provide that hospital bed, that ICU bed, that ventilator to anybody who needed it when they needed it. Now, we have treated as a strategy the entire state of Nebraska as one big hospital system. And so we have set up a transfer center to be able to move patients from one hospital to another, or even one region to another, if it was necessary, to make sure we could balance the load about how many COVID patients that hospitals were taking. One of the great partners in that has been Mel McNay at Great Plains. They have just been a tremendous partner, always willing to step up, be able to help out. You may recall early on in this pandemic, we were looking at increasing hospitalizations and cases in Lexington, Nebraska. Mel, who is the CEO of Great Plains, has worked very diligently with us. He set up a couple of ambulances and a helicopter to be able to make sure we could transfer patients out of Lexington if necessary. He's been willing to take patients from long-term care facilities, really flex his hospital staff and capacity up. He's really just been a tremendous partner. And frankly, we have seen that kind of cooperation from all of our hospital systems here, but Mel has just been tremendous with regard to that. Yeah, can you get him on there, Ryan? I'm saying all these nice things about Mel. Can you even hear me? Mel, you hearing all the nice things I'm saying about you?
Yes. Good morning.
Good, good.
Governor,
well, hold on. Before I get done here, also, I got to recognize you. You were named Rural Hospital of the Year 2 years in a row now. That's one of only 19 hospitals across the entire nation, and the only hospital in Nebraska. So congratulations on that designation.
Yes, we're very thankful for our staff and their dedication to quality, safe care. And I'd like to share with you on behalf of the staff of Great Plains Health, thank you for your kind words too. We really appreciate it. And I want to wish everybody a good morning. And I want to let you know that the spirit of the canteen and effort during World War II to provide nourishment to all troops traveling through this community from the east to west coast is alive, as healthcare organizations in West Central Nebraska have partnered to fight COVID-19 virus. This pandemic continues to challenge the way we deliver care as we gain more knowledge and have a better understanding of how the virus actually operates. Today, I've been asked to share some of the innovative changes implemented through the organization to ensure quality, safe care in that rapidly changing environment. Before I do, I want to thank Governor Ricketts and Dr. Antone for their leadership in helping organizations like Great Plains Health deal with the impact of COVID-19. They've been great partners, and I really appreciate it from the bottom of my heart. The organization early on in this pandemic implemented an interdisciplinary team approach to clinical care within the facility. We have timely communication regarding the status of all of our patients and making sure resources are available to our nursing staff. We actually meet daily to discuss every patient within the organization, whether they're COVID positive or not. That timely discussion helps us to remove barriers for care and processes, and a member of that team is a member of our administrative team assigned to do those timely follow-ups. Early on, our ER physicians during this last spike identified a type of patient that could use oxygen and then oximetry in their home, and we were able to avoid admissions into the hospital when beds were scarce for a period of time. We follow all those patients up with our care coordinators to make sure that they're safe and that they're recovering appropriately. Providers at Great Plains Medicine, or Great Plains Health, have also participated in a wide variety of trial and research medication, including Visavil, which reduces the length of stay and ventilator usage within our organization. We also had a team of staff facilitating the giving of monoclonal antibody drugs in the nursing homes and in the outpatient setting. Preliminary results are really encouraging. We've seen a decrease in admissions and reduction in the length of stay for those patients receiving that medication. Staff have also engaged with family and patients at a different level, talking about desired course of care, and actually facilitated end-of-life discussions and if there's a need for palliative care when appropriate. Leadership has also worked closely with our critical access partners in the region to manage the volume of patients needing treatment. And I want to compliment those facilities that worked with us. It was a bi-directional flow of patients. I'd like to acknowledge the hospitals in Lexington, Ogallala, McCook, Grant, Valentine, Gothenburg for their willingness to work with us and set aside barriers to meet the spike in admissions we recently experienced. Leadership work collaboratively with nursing homes in our region, and we do that all the time, but more so and more frequently here lately. We helped establish a COVID-19 unit within one of the nursing homes, which allowed residents in other nursing homes that tested positive to quickly be relocated to this unit and stop the spread in the healthy units or nursing homes. Dr. Freitas, our infectious disease physician, has provided consults with area providers to ensure safe quality care and continuity of care throughout the region. As patients recover, the new challenge we're facing is referrals to rehab centers for recovery. Some of these patients have been in a bed for over 20 to 25 days or on a ventilator. We notice the need and the difficulty in referring to rehab facilities. So starting Monday, our rehab staff will start initiating processes that usually occur in a rehab facility upon admission of our patients so that we can reduce the need for long-term rehab transfers. Those are a few of the things that we're doing, Governor Ricketts, and I want to thank you for letting me share some of those and some of what's going on as we continue to fight this COVID-19 across the state. Thank you.
Great. Hey, well, thank you very much, Mel. Again, you and your team have just done a fantastic job, and I am just personally grateful for all your efforts of you and your team to be able to help make sure we're taking care of Nebraskans. And just the flexibility, the innovation, everything you've done has been very impressive. Do you have a few minutes to take some questions? We've got some, if you've got time, we can do things a little differently this morning and take some questions here if you've got the opportunity. Mel, do you have time?
I do, sorry. Yes.
Okay, great. So we're going to change things up a little bit today. We're going to ask if anybody here in the room has any questions for Mel. And if there's anybody who's online and wants to email them in, they can do that real quick too, or text them into Justin. You got a question, Justin?
Not specifically for Mel right now.
All right, Andrew?
Have you heard when you will get the vaccine and how quickly will you?
Oh, I just want to questions for Mel.
Yeah.
Okay.
Yeah. What has he heard about?
Okay. Sorry. So Andrew is asking what you have heard about receiving vaccines.
When are we distributing the vaccine? I'm sorry, there's a little bit of echo there, but yes, we're hoping that we will receive the vaccine the first part of the week. We're working with our partners at West Central Health District to make sure that we distribute that vaccine quickly and to use every vial that has been given to us. So.
Yes, Andrew.
And also, kind of react to that we're one day away from, I guess, going into yellow and what that means for hospitals.
So Andrew's asking you, what does it mean to potentially be one day away from moving from orange to yellow, and what does that mean to hospitals?
Right now, moving into different color indicates that we're going to be able to perform more elective surgeries. We still will be monitoring our beds closely to ensure that we have beds for our acute patients, because we are also treating individuals with stroke, heart attacks, a lot of acute issues that we cover a 17-county area, provide those services to. And so we monitor that on a daily basis, and we adjust our surgeries accordingly, just not for COVID-19, but for other critical care that we need to provide.
Fred.
Has he experienced people staying away with heart problems and that sort of thing?
Have you experienced other patients, maybe with heart conditions, staying away from the hospital because of coronavirus?
We've been tracking our volumes and we've trended it over the last year. We've made an aggressive approach and a marketing approach to ensure that people come back into our clinics so that our ER is not overrun. Currently, what we're seeing is we're treating the same volume of patients that we were treating back in January and February. So we're starting to see patients come back. We've also created a lot of opportunities for the patients and physician interaction through telehealth. And we have a wide telehealth network that allows the patients also receive their care through telehealth. A lot of our psychiatrists are actually doing their consults through telehealth.
Andrew, do you have another question?
I was just wondering, as far as the going into orange, going into yellow, I guess, has he seen a change in attitude of people, in their precautions, and then is he worried that if we go to yellow that we might see the reverse?
So what Andrew Ozaki is asking is, have you seen a change in people's attitude as we've been in orange now for almost a month? And are you concerned that if you have seen a change, that the people are being more careful, that they may not be as careful now that we're going into yellow?
I think we have to continue to market and also share how we can keep each other safe from this COVID-19. I think our medical staff have been really instrumental in sharing that message with their patient. I think we need to continue that. I don't think there will be a letdown, hopefully not, because there's a lot of factors to this, and people can still get COVID-19 if they're not vaccinated or just through normal spread. So I'm hoping that we see a decrease in COVID-19 admissions and we continue this trend.
All right, Justin, you got a question for?
Yeah, this question's for Mel. Comes in
Here,
from
you just
Paul
tell it to me.
Hamill.
I'll repeat it so we can hear him.
Yeah, Paul Hamill from the Omaha World Herald. How much have you been able to reduce hospital admissions by administering oxygen at homes?
So Paul Hamill, the Omaha World Herald, would like to know, how much have you been able to reduce hospital admissions by using oxygen in the home, by administering oxygen in the home?
I think we haven't had a chance to really track that data yet. Anecdotally, our ER physicians are real conscientious on who they allow to use the oxygen at home. And we also provide the oximetry, which allows them to measure their level. And then our care coordinators are calling on a routine basis to these patients. But what I will tell you, it's been enough patients that have allowed us to admit critical patients and not have to transfer them. Currently, right now, we have received patients as far away or transferred to us as far away as Oklahoma. So we've been able to not only meet the needs of North Platte, but also the needs of some of the surrounding states too that are in desperate situation. We have had to transfer patients from North Platte early on in the spike of this last spike that occurred. But a lot of those patients were transferred to our critical access partners so we could maintain a level of beds with a higher acuity, treating those more severe COVID-19 patients. That data should be coming out, and I'd be happy to share it.
Any other questions for Mel? Oh, Andrew, anybody else? Questions for Mel? Mel, again, I just can't tell you how impressed I am with you and your organization. You've done a fantastic job. Please, will you tell your team how grateful we are for all their long hours taking care of our coronavirus patients as well as the other patients they take care of. You guys just been doing a fantastic job, and we very much appreciate it. And we know we still got months' work left ahead of us, but we're very excited now that this vaccine is hopefully going to be coming to us next week, and that's really kind of the light at the end of the tunnel. So we look forward to working with you with regard to that vaccine administration as well.
Thank you, Governor Ricketts. It's been an honor.
Great. Thanks, Mel. Merry Christmas. All right. Again, just wrapping up here again, our schedule for next week will be Monday, Wednesday, and Friday. Yeah, oh, no, I'm not wrapping up. I got questions, I know. Usually I talk about this before we go into Q&A. Monday, Wednesday, and Friday, and then that'll be at 10 a.m. on Monday and Wednesday. Because of the Nebraska State Patrol graduation on Friday, we will do our press briefing on Friday at 9 a.m. So we'll be starting a little bit earlier next Friday to accommodate the schedule for the Nebraska State Patrol graduation. And now we will go into broader questions. And Justin, what have you got for me there?
Got some questions here. One comes in from Paul Hamill about the Texas election lawsuit. He wants you to comment on criticisms that that lawsuit is without merit. And then he has a follow-up question about the lawsuit complaining that the election rules were applied differently in different counties within the state, but he wonders, doesn't Nebraska do that as well by allowing some counties to conduct elections by mail only and others to conduct it by polling place?
So Paul Hamill, the World Herald, is asking about the lawsuit where the Attorney General signed on with 17 other states to do an amicus brief with regard to that Texas lawsuit. And that was about, again, making sure that states are actually following their own laws, and how that if you don't follow your own laws in one state, it can impact the other states in a national election such as this. And that the key there is two things. One, that we're following the separation of powers. So, for example, the legislative branch and the judicial branch don't get to make laws. That's the prerogative of the legislative branch. The executive and judicial don't get to do that. And so if you're going to change your election law, you have to do it through the proper way, which is the legislative branch. And that's the basis for the lawsuit, as my understanding, from Texas, and how Nebraska signed on as the amicus brief on that. And then the other part is just in general, we need to make sure we're avoiding election irregularities. So again, that's something that we all believe is in the separation of the three branches of government, and that's what this lawsuit is about. And I think it's perfectly appropriate to be able to say, hey, if you're not following your own laws, that's a problem, especially when you're talking about a national election. And then with regard to the counties within a state, again, that would be dependent upon state law. So, for example, if we do have areas in Nebraska that have mail-in voting, that was done all, again, very appropriately through the legislative process to be able to take care of.
We have another question that comes in from Grant Schulte with the AP. Do we know yet when and where the first vaccines will be administered in Nebraska?
Grant Schulte from the AP is asking, do we know when and where the first vaccines will be administered in Nebraska? And again, for security purposes, we're not saying exactly which hospitals or when exactly they will be receiving it. I can tell you, Grant, that we are expecting to get, now that the FDA is approved, those Pfizer shipments, 15,600 of them, next week. They will distribute to 8 hospital systems, and that those 8 hospitals will work with 9 other hospital systems to be able to inoculate hospital staff that deal with coronavirus patients and other patients, but keeping the hospital staff who are the frontline workers healthy, as well as those EMS folks who are dealing with coronavirus patients.
Another vaccine question comes to us from Julie Anderson with the Omaha World Herald. Does Nebraska have enough federal funding to effectively roll out vaccines? And then Julie cites that she's heard from some public health organizations that the country needs about $8 billion to get the job done. That's far less than that. She says as little as $200 million.
So Julie Anderson is asking about whether or not there's sufficient federal money to be able to roll out the vaccine program. And I have not heard of anybody who is, not going to be able to roll out vaccines because of a lack of money so far. Obviously, we at the state are monitoring very closely what's going on with regard to the stimulus package, because that has got some additional money for states to be able to do the vaccine program. However, we will budget it one way or another to make sure that we get the vaccines rolled out. So I don't anticipate that's going to be a problem, at least not here in Nebraska.
Becca Costello with NET has a question about our phase thresholds. She asks, are those numbers, the percentages, rounded up or down to a whole number? If, for example, we're at 19.5% after today's numbers, would we stay at orange, or would we go to yellow?
So Becca Costello is asking about, with regard to our numbers, and maybe you can put that chart back up again, we set 20% as a threshold. Are those numbers rounded up or down? They're not rounded. So if we're below 20%, we're below 20%. 19.5 would be below 20%. Great. All right, Andrew, Fred, got questions in here?
What are the other effects, aside from elective surgeries, of moving back from ours?
What are the other effects? I'd refer you to our chart on the DHH website to get the complete things, but I'll give you just kind of a sampling of them. Extracurricular activities, we'd limit that to households. That will be broader now. It won't be limited just to households for those extracurricular activities for school kids. Indoor capacity will go from 25% to 50%, so that will be expanded. The 6 feet separation that we require, for example, at those indoor events will go from being in the DHM into guidance now, so we still think that's a good idea to keep that 6 foot of separation. And actually, we had some discussions about this as well. for example, if you have a school gymnasium, the school can still take steps to be able to limit the number of people in there. If they want to be more restrictive, they could certainly do that. And then, of course, any event that has more than 500 people is going to have that health director, that local public health director's submit a plan submitted to the local public health department, and that plan be signed off on. Also, we had in the DHM in Orange that you had to wear a mask in any business that was closer than 6 feet to somebody else for staff and patrons for 15 minutes. That will be now just specifically for things like salons and so forth. So masks in salons, barbershops, et cetera. Actually, all that stuff goes to guidance now. So that was in the DHM, now that goes to guidance.
Including for the salons.
Including for the salons, right. Yeah, Andrew.
Are you concerned that some businesses may have to pay extra taxes because they got some of that PPP money as well as some of the state grants? And I guess on the federal level, since we're piggybacked, I mean, is there anything on the state level you could do to hold harmless some of these businesses that did get some of this relief money?
So the question was about the Paycheck Protection Program, where businesses received, actually here in Nebraska, we received like $3.4 billion. It was over 40,000 organizations received $3.4 billion. Originally, Congress's intent had been for that to not be taxable, and then the IRS came out with a ruling saying that, yes, it was taxable, and my understanding is, in the next bill that Congress is debating right now, that they are going to make clear that that will not be taxable, and Nebraska, as a piggyback state to the federal tax code, will follow that as well. So if they clarify that it's not taxable, it won't be taxable under state law either.
Do you know where that's at? I mean, is that, will the state act, I guess, how much money will the state get if that isn't enacted?
So the question was, with regard to the state specifically, do we know where that provision is? My understanding that's part of one of the things that's going to be in the next stimulus package that is supposed to be rolled out. I can't predict when that would not be done. And of course, any change that, we follow the federal tax code, so any change that we would do to change from that would have to be done in our state tax code. When we were doing our forecasting, we went with the original guidance that was coming out that those dollars would not be taxable. Yeah.
That Carnegie Mellon study that you cited to make the point that mask compliance was the same in Nebraska as Wisconsin, where there's a mandate, found it was self-reported, and it found that something like 90.6% of Nebraskans say they wear the mask all or most of the time when they're out in public. Is that consistent with your observation?
So Fred's asking, we tweeted out a Carnegie Mellon survey that, again, self-reported survey of how many people are wearing masks. Some are all the time when they go out in public. And Nebraska was about 90%, which I don't know if you went back and looked at some of the historical data, but that number had been going up. And I think, again, because we had taken the step to go into the orange phase and our increasing cases and hospitalization, so I think people were more aware and people were wearing more masks. So I do think that, the number 90% is a self-reported number, but it's also the same number that's roughly the same as Wisconsin had been reporting.
Right, but when you go out, do you think 90% of people are wearing masks?
So when I go out, I got to tell you, Fred, I've been slowing down as well. So I've been really going from work here in the Capitol to my house. I have not been going out much. When I have gone out, I have seen that, at least in Omaha, people are wearing masks. Yeah. Andrew.
You're a big states' rights guy, federalism guy. I mean,
Okay, when you start the question that way, Andrew, I know something's up.
what would you think if another state challenged your election laws?
So the question is, I'm a big states' rights guy. What would I think if another state challenged our election laws? We're not challenging their election laws. We're challenging their process. What we're saying is, hey, if you're not following the process of changing your laws through the legislative branch, that's the appropriate constitutional way to do it. You have to do that just like everybody else does. Every state has to follow that, unless you have a law that allows something for different. You can't just make up laws in the executive branch. You can't make up the laws in the judicial branch. Certainly, this is one of the things that we talk about a lot is judicial activism. You cannot legislate from the bench. So we discourage that from our judicial branch, but you've also got to discourage it from the executive branch. There's been many cases as we've gone through this pandemic, we've talked about, can the governor's office do this? And the attorney general's advised, no, you can't do that. You can, because you don't have the ability to, create a new law or whatever. You can waive a statute that maybe allows for somebody to do something, but you can't, do something else. You've got to act within the laws or the Emergency Management Act as they are written. And so that's true for Nebraska, it's true for everybody else. So if we were acting outside of our prerogatives, I would hope that actually before some other state, brings it up, that somebody here in Nebraska would be doing, be saying, hey, you gotta follow the law.
And why isn't this just a political maneuver by Republicans? Explain it.
So again, so Andrew's saying, why is this not just a political move for Republicans? I think the separation of powers is a profoundly held belief in this country and is important to our very republic and the foundation of our country, that we follow the rule of law and we have the separation of powers. That's not a political stunt. That is the foundation of our republic.
So if Joe Biden would have lost and Trump would have won, would you still have filed this, or would you still have joined in a suit similar to this?
So the question is, I can't talk about hypotheticals. He's saying, Andrew asked, if Joe Biden had lost and Trump had won, would the Attorney General be filing an amicus brief? That's a hypothetical. It would depend upon the facts and circumstances at the time, so there's no way to answer that.
Well, this is a hypothetical too, but
Fred, I just said I can't answer hypothetical questions. Now, you want to ask one?
hypotheticals that you like that you answer. If the Supreme Court were to take this case and say, yep, we agree, what do you think the public reaction would be?
The question is, if the Supreme Court were to take this and the Supreme Court would agree, what would be the public reaction? You know what? There'd be people who would be happy with it and people who would be unhappy with it. Just like every decision that ever gets made, there's going to be some people who like it and some people don't.
Governor, we've had a few more questions get texted in. One from Dawn Walton from the Lincoln Journal-Star on the same topic. Governor, do you support the goal of the Texas lawsuit, which Dawn claims is to overturn the presidential election?
So Don's asking, do I support the goal of the Texas lawsuit? What I support is following the rule of law. That if these states did indeed not follow their proper state law, they did not have, follow the separation of powers, then they ought to be held accountable for that. Again, I'm not an attorney, so that is something for the attorneys and the courts to decide. And again, we have a process for this, right? This is part of the process that we have, is that aggrieved parties can go to court on this.
Becca Costello from NET has a question. Weekly COVID-19 deaths are now nearly 10 times higher than in May. With the vaccine so close, why not keep or even increase restrictions to save lives over the next couple of months?
So Becca Costello is asking, we've seen increasing deaths, and certainly that's true, with increasing cases and hospitalizations. Why not just go to a hard lockdown and wait till the vaccine? What we have done through this entire pandemic is focused on our hospital capacity. It's a virus. You cannot stop it from coming. What you can do, though, is slow down the spread enough to be able to preserve your hospital system, and that's what we've done through the entire pandemic. That's been our strategy since day one, and we're going to continue to follow that strategy.
And Governor, Julie Anderson asked to follow up if you had any more specifics on the first vaccine shipments and when they would arrive.
And so Julie Anderson from the Omaha World Herald is asking, do we have any more specifics with regard to the first vaccine shipments and when they're going to arrive? And again, for security purposes, we're not going to say specifically when they're going to arrive, other than we expect to have them arrive next week. And we're not going to give out the specific locations, other than to say there'll be 8 hospital systems who will receive those initial ones, working with 9 others.
So does that mean a total of 17 hospitals?
So that would mean a total of 17 hospital systems will be getting access to some of the vaccines.
Hospital systems, what?
Yeah. So again, we're not, for specifics, I'm not going to get, for security purposes, I'm not going to get more specific, just because we want to make sure that anybody who may want to cause a problem with this doesn't have the opportunity. Yeah, Andrew.
Do you have any more clarification on that delay on the second and third shipments from Pfizer?
We have not had, the question is, have we had any more clarification from Pfizer about what the delay on the second and third shipments would be? To this point, we do not. We were originally supposed to get in the second week of receiving vaccines, so that would be week after next. We were supposed to get 19,500. We don't know if that means that all 19,500 are going to be pushed off. We've been told that maybe we will receive some allocation of that in the second week, but we still have not been confirmed how that's all going to work out, whether it's going to be some allocation or if that's all going to be pushed off to a later time.
And I know you don't like hypotheticals, but I'll ask you one anyway. If the Supreme Court does take this case, what happens on December 14th?
So the question was, if the Supreme Court takes this case, what happens on December 14th? And again, I'm not an attorney. That is a question for the courts and the attorneys to sort out. I don't know what the implication of that would be.
Becca Costello has a question for Dr. Antone.
Dr. Antone, can you come up, please? Becca Costello has got a question for him. Please remember to repeat the question.
So Dr. Antone, again, this comes from Becca Costello with NET. She would like an update on cases and deaths in long-term care facilities.
Rebecca Costello wants to know about the number of cases and the number of deaths currently in our long-term care facilities. So this is as of this morning, there are now 3,884 residents in long-term care facilities that have tested positive.
And Dr. Antone, that's throughout the course of the pandemic.
This is through the whole, cumulative for the whole course of the pandemic, as the governor stated. There's now 579 deaths in long-term care facility residents for about a 44% rate over our overall deaths. So 44% of our overall deaths have been people that have been in long-term care facilities. The number of facilities that have reported cases are now up to 496.
So essentially all.
Yeah, almost every facility now.
And then staff?
The staff, I don't have that number for today, but for the last data I had for staff, I'll have to get back to you on the staff right now,
I
Fred.
think it was about 2,800. Get the data.
2,800 staff, around 2,800, but I'll get you the exact number. Yes.
Dr. Antone, since you're up there, I mean, what would your message be to the public if we do go down to the yellow? And, it appears like we're getting there. What would your message be to the public?
So Andrew asked if we do go down to yellow and what would our message be to the public? The best statement I heard was from Dr. Hahn from the FDA that said, we've held down the fort now for almost 9 months, and now we see the cavalry coming. Now is not the time to quit fighting. Now is the time to actually increase the fight, knowing that the cavalry is coming. So my message would be, don't give up the 3 C's, keep up the 3 C's, know that there is the cavalry or light at the end of the tunnel coming, and just let's wait that out. One of the things we heard on a call the other day is that the month of December, there will be 20 million inoculations for vaccine. During the month of January, there will be 30 million. During the month of February, there'll be 50 million. That's almost 1/3 of the population now of the country being vaccinated by the end of February. So this is not the time to give up. This is the time to, especially the people that will not be vaccinated, to keep as vigilant as possible. And, like I say, the cavalry's coming.
Thank you, Dr. Antone. I just want to stress what Dr. Antone said. Even with the vaccine coming and even with us moving from orange to yellow, now is not the time to stop practicing all the good rules we know about wearing a mask when you go to the store, staying home when you're sick, washing your hands often, keeping that 6 foot of distance, work from home if you can, shop once a week by yourself. All those things are still important. Avoid the 3 C's. Even with the light at the end of the tunnel here, we got to continue to remain vigilant to be able to slow the spread of the virus and preserve our hospital capacity. Was there any other questions that came in, Justin?
No, that's it.
Andrew?
Yeah, I've got another hypothetical. Have I reached my limit yet on hypotheticals? Let's say we go down to yellow, and you're going to reduce some restrictions just before Black Friday. I mean, how big of a concern is that, when you're talking about that possibly additional crowds and your mask mandate not being in effect?
So the question was, what about going to yellow right before Black Friday? I thought Black Friday was the
Well,
day
not
after,
quite, I'm sorry.
right before the shopping season, right? Shopping season.
If it was like in
Yeah, so again,
Sorry.
yeah, no problem. Black Friday was like the Friday after Thanksgiving.
So it's not hypothetical.
So anyway, with regard to the retail establishments, again, the DHM that was impacting businesses with regard to wearing masks when you have staff and patrons that are in close proximity for 15 minutes or more, that's 6 feet, wouldn't necessarily apply to the retail establishments. But again, what I see from retail establishments is that they have been for months now taking steps to spread out their customers, putting those signs on the floor, stand 6 feet apart from everybody, putting up plexiglass. Their staff are wearing masks. I would encourage Nebraskans, if you're going to go shopping, you still want to wear a mask when you go to the store. That will help slow down the spread of the virus. Hey, and here's the deal, folks. It's the holiday season. You don't want to be quarantined. You don't want to be sick, and you certainly don't want to be in the hospital. So take these steps right now. Slow down right now so that you can avoid any of those things here in the month of December as we lead up to the holiday season. And of course, we started Hanukkah last month, or last night, rather, sundown last night. So we're really in the holiday season right now, so you don't want to miss that time with your families. So take the precautions, slow down. Yeah.
Another question come in from Becca Costello. How can the state tell Nebraskans not to give up the fight when the state is about to reduce its restrictions? Doesn't that seem contradictory?
So Becca's asking, doesn't it seem contradictory to say, the state saying don't give up the fight when we're loosening up some of our restrictions, and it's not contradictory at all. We're telling people continue to practice all the tools. We are loosening up some of the restrictions, but we still have restrictions in place. And again, this is all about managing our hospital capacity, which is what loosening the restrictions is about. So it actually fits in line entirely with our strategy we've managed throughout this entire pandemic to be able to base the restrictions on where our hospital capacity is. But that's going to also depend on Nebraskans continuing to practice all the good tools that we've given them to be able to slow down the spread of the virus. All right, seeing no more questions, I'll just wish everybody a great weekend, and please continue to slow down here as we go into the holiday season, and we want to slow things down so that people don't get sick and can see their families. Wear that mask when you go to the store, wash your hands, keep that 6 foot of distance. I also do want to say thanks to all the folks who've sent me Christmas cards with encouraging notes. I do truly appreciate all the kind words that people have been sending in, so thank you very much for that. And then, of course, finally, we also have a big football game tomorrow, so let's cheer the Huskers on, and that will help us maybe get to a 500 season here before the end of the month. With that, thanks very much, and we'll be again back here at 10 a.m. on Monday. Oh, and please, don't forget about Test Nebraska. We've got space available, so please come in and get tested. Thanks very much, and we'll see you on Monday. Thank you, Ryan. Thank you, Jamie. Appreciate it.